Hello, everyone, and welcome to this important discussion on women's cancer. In our virtual session, Think Pink, Act Now, Screen, Fight, Win, organized by Voice of Healthcare and Cadila Pharmaceuticals. We highlight the power of early detection, advancements in treatment, and the vital role of awareness in saving lives in this session. Despite significant medical progress, many women still face barriers to screening due to fear, misinformation, and lack of access. Addressing these challenges, particularly in underserved communities, is especially important for early detection and good outcomes. Ensuring that innovations like genetic testing, precision medicine, and AI driven diagnostics reach everyone is crucial step towards equitable healthcare. Beyond treatment, comprehensive cancer care must also focus on emotional and psychological well-being. Strong support system and education play a pivotal role alongside medical advancements in empowering patients and enhancing the quality of life. We are honored to have Dr. P.S. Dattatreya, HOD Medical Oncology, Renova Sowmya Cancer Center, Hyderabad, to discuss this. Let's engage, learn, and work towards a world where prevention and early intervention make cancer less of a threat. Welcome, Dr. Dattatreya.
Good afternoon to everyone. Thank you so much, madam.
So, Dr. Dattatreya, why is early detection so critical in improving cancer survival rate? And can you share some real life cases where early diagnosis had made a significant difference?
Yes. So essentially, my name is Dr. Palanki Dattatreya. I work as a full-time medical oncologist and I'm the director and the chief of medical oncology at the Renova Sowmya Cancer Center in Hyderabad, Telangana. And as madam rightly pointed out, in this Voice of Health today, we intend to showcase the importance of diagnosing diseases early. And that's most important when it comes to cancer because we all know cancer is curable if diagnosed early and then treated appropriately. And when you want to find out cancer early, you mean when there are no signs and symptoms. The disease is sending no warning signals to us. You get investigations done. You get in checkups done by your family doctor or your lady doctor. And then you realize there's a small lump or a small bump or some node here. And then when investigations further are done, it comes out to be cancer. And then more or less, it would be stage one. And once it's stage 1 cancer, then the chances of cure are more than 90 to 95%. So, cancer is curable if diagnosed early, if detected early, and treated appropriately. We do what is called a screening, and at this point of time, 5 cancers can be identified early by screening. Tops the list is breast cancer, mammography, breast self examination, and clinical breast examination is the way to screen and identify benign or malignant breast lumps and act immediately. So, act now. That's what is today's focus. And mammography, as we all know, has identified so many breast cancers early on that in the West, you find more of the breast cancers being stage 1, stage 2 at the most. Whereas in India, till some time back, say 10 years back or 20 years back, we used to find locally advanced diseases or advanced breast cancer. But now we too are gradually finding and we have moved towards identifying more and more breast cancer because of the executive health packages, because of the annual checkups we do, what we called as the master health checkup, and that has made a paradigm shift in the way we see more and more breast cancers now getting picked up in more and more women at an early stage. And that's why it's so important to screen and make sure that we don't miss out to identify a breast lump which otherwise would not have been felt by the woman. Second
Right.
is
Yes.
second is cervical cancer. By pap smear, we identify cervical cancer early. Third is prostate cancer in men by doing PSA levels, a simple blood test after 50 years of age. Annually identify prostate cancer early. And lastly, colon cancer, and rectal cancer. You can identify by stool occult blood test and by doing regular colonoscopies.
Rightly said, sir. And I also believe that mammogram is a very good tool and it can catch the breast cancer early, especially, in stage one where surgery can cure it and it should not metastasize and then the patient should present to us. Right, sir. So, what do you think are the biggest barrier preventing women from undergoing regular screening like mammogram, you have told, or pap smear or genetic testing? And how can we break these barriers, especially in rural and underserved communities?
So seminars like what we are doing now, webinars like what both men are engaged in right now, takes the voice of healthcare to all the people around, and that's why you find screenings happening commonly in the urban areas, in the tier one cities, maybe in the tier two towns also, and that's why you find majority of these cancer screenings are identifying more and more cancers in the earlier stage in all our urban registries for cancer. So population based cancer in India also clearly tell us that in urban cities and in tier 1 tier 2 cities you find more of screenings happening, identifying more cancers early, and therefore leading to more cure rates in that segment of population in our country. Areas like villages, small towns, where percolation of knowledge is not happening for various reasons, including ignorance of the villagers or the town dwellers. There you find that these things are still neglected. And then we end up getting problems like advanced disease or locally advanced or loco regionally advanced breast cancer, or for that matter, any other cancer. And so, ignorance cannot be bliss. Ignorance is not bliss. Knowledge is power. More so for such diseases like cancer, like malignancy, like neoplasms. And I think it's so important that we keep on disseminating knowledge like what we are doing right now with all of you around, because then this dissipation of knowledge only becomes a powerful tool to identify diseases or ailments before they can harm that particular individual irreversibly. And that's why I would like to end by telling that ignorance is not bliss and knowledge is power.
Right. Knowledge and power, and we should educate ourselves of getting screened and getting diagnosed early. Many women fear cancer screening, maybe due to some myths or misinformation. So, how can healthcare professionals encourage routine checkup without causing unnecessary anxiety?
So all these investigations, these tests which have been told, and these are being already confirmed in randomized controlled trials. So these are not fancy investigations. They are not my women fancy that we should get the investigations done. These have been brought out of a lot of trials, and therefore this becomes evidence-based practice. We write an investigation based on evidence of randomized controlled trials, and that too not one but multiple trials, checked multiple times and many generations, and then that becomes a part of a guideline. And so, guidelines and recommendations are strictly followed when we are trying to write some investigations as part of cancer screening for that particular cancer. Previously, say 15, 20 years back, we used to feel that the diagnosis of cancer means cancel. The diagnosis of cancer, I agree, sends a shiver down the spine of even the strongest of human beings. But now we know that with all the powerful tools, investigations, and tests we have, we can identify cancer early. And then you can cancel cancer. So in cancer, we have can, and therefore we can cancel cancer provided we stick to the guidelines and recommendations and get a proper health checkup or executive health checkups done as per the guidelines. And that's why it's so important to educate the layman, the public, and also my fellow doctor colleagues, including MBBS doctors and MD physicians, who and my gynec colleagues, etc., also, so that the updates about how screening should happen for various malignancies, including breast cancer, cervical cancer, prostate cancer, colorectal cancer, and to some extent for identifying lung cancer early in heavy smokers. So there we have strict guidelines for cancer screening, and that changes the scenario of identifying that disease early on. Sometimes we go for a checkup for a different problem, and ultimately some other lump crops up. Incidentally, it's diagnosed early, and that leads to a more than 90% cure rate. So it's so important that we dissipate and disseminate knowledge and keep on repeatedly doing all these kinds of webinars and seminars because it's all word of mouth.
Yes, exactly. So these are evidence-based tests, and we should make use of it as widely as possible and educate people. And there should not be fear around cancer screening at all. So, what does family history, play a role in women's cancer risk, and how can genetic testing help in proactive healthcare?
Very nice question, madam. I think it's so important that not only is the patient positive about the whole diagnosis and treatment, be informed about why we are doing what we are doing, but the atmosphere around the patient plays a very important role. And that atmosphere is the patient's family members, the kith, the kin, relatives, and the friends. And they make a lot of difference in the outcomes. Half the battle is won if the patient is positive about the outcome, if the patient believes that the treatment being given to him is or her will cure that particular ailment and disease and cancer. And the remaining half, our medications, our surgeries, radiation therapies will tackle it comfortably. So half the battle is won when the patient is willing to fight the disease and the family is with them, supporting them to fight the disease. So that positive atmosphere, those positive vibrations around the patient play a important role in the outcome of these patients. If we want to improve the oncologic outcomes of any particular cancer, then it's important that the family comes together to fight the disease. It has been a crusade to cancel cancer for the past many decades and centuries. It has been a fight to beat cancer. It's been a battle to beat cancer. It's been a combat to conquer cancer. But that's not possible if, along with we doctors, the family members, the kith and kin, the relatives, and friends are together in the patient's journey. And so, I would again like to stress that a positive atmosphere, a positive attitude goes a long way in keeping these diseases under control and cure these patients once and for all. Finally, we have to understand that a few of the cancers, for instance, breast cancer, around 10 to 15% of them, or 5 to 15% of them, some of these breast cancers could be. Am I audible, madam? Yeah.
Yes,
Some of these breast cancers could possibly be caused because of a defect in a gene which is percolating in generations. And the most famous example is Angelina Jolie. Her mother had breast cancer first and then ovarian cancer. Breast cancer got cured first, but after 4 5 years, ovarian cancer surfaced. And so the doctors thought that okay, same lady, first one female cancer, female organ, again, second female organ gets cancer. So breast cancer first and ovary cancer later. So is there some gene which is driving the female organs to develop a tendency to get cancer? And lo and behold, they found that there was a mutation in the BRCA1 gene. BR for breast, CA for cancer. So breast cancer causing gene 1, and that BRCA1 gene abnormality also caused the ovary cancer later in her. And this abnormality can percolate in generations. We did lose Jolie's mother in the fight against ovarian cancer. She won the breast cancer part, but after 5 years, when the breast cancer, the ovarian cancer came to resurface because of the BRCA1 gene, then that was in an advanced stage. Anyway, Angelina Jolie now gets herself tested to see if that bad gene has come to her. And lo and behold, she tests positive. She has the BRCA1 mutation present. Now she has a 87% chance of getting breast cancer. She doesn't have it, but there's a mutation and that can make breast cancer surface at some point of time. 50% chance of getting ovarian cancer. So what does she do? In 2013, she gets both the breasts out. So no breast, no breast cancer. In 2015, she gets both the ovaries removed. So no ovaries, no ovarian cancer. So these surgeries have reduced the risk of breast cancer by 87%.
So there's some network issue, sir. Dr. Dattatreya, there's some network issue. I can't hear you, sir.
Sir, you are on mute.
Sir, please unmute yourself.
She doesn't have to take that extreme step. Every patient doesn't have to, but regular surveillance can identify the problems early. And that's why, on one hand, positive atmosphere. On the other hand, when people like Jolie come out in open to talk about these problems, it makes a lot of impact on the layman and the public because the celebrities can send strong messages. When Deepika Padukone talks about depression, depression is no longer a taboo. So that's why, on one hand, atmosphere is positive, the family member. Second hand, on the other hand, do get checked for the germ and mutations because you can alert your family members, your brothers, sisters, and children that if a gene has caused the problem, then they also can get the investigation. If not, then they can be comfortable.
Right, sir. So genetics also play part, and plus you have rightly told that kids and kin and family support is required when a person is going through treatment of cancer. Right, sir. So, what, according to you, sir, are some most promising breakthroughs in cancer treatment, especially when breast, cervical, and ovarian cancers are concerned?
Most promising what, man? Sorry?
Most promising treatment options, like
Treatment
treatment which have
options.
come up
Yes, yes.
today. Yes.
Yeah. So, how do we treat cancer? We snare it, we burn it, we poison it. We snare it, surgical oncology. We burn it, radiation oncology. And then we poison it by using chemicals, which are cytotoxic chemicals or cytotoxic poisons. So that's chemotherapy. Therapy with chemicals, that's medical oncology. On top of that, recent and many new advances in each of these fields, surgical, radiation, and medical oncology, have made the cure rates go really high. For instance, in surgical oncology, we talk about laparoscopic surgery and robotic and laser surgeries. In radiation oncology, we talk about therapies like VMAT, IMRT. We talk about more improvements like IGRT, rapid arc, and also protons as treatment options. In medical oncology, we now don't talk about the chemotherapy, we also talk about targeted therapy, about immunotherapy. And so, all these new developments are making the field very exciting because what 50, 60 years back was thought as written off, now all these diseases can be tackled very well by using a combination of all these different modality. And here I would want to explain to all of you the concept of multiple disciplines coming together for that particular patient. It's not a one man show. It's a teamwork of a surgeon, of a radiation oncologist, and the treating medical oncologist. So, as a team, the whole team comes to jointly take care of that person. It's something like the Army, the Navy, and the Air Force, all of them come together to defend the country's honor. The Army is surgery, the Navy is chemotherapy in the blood, which is the medical oncology part, and the radiation is the Air Force, the X rays. So, a combination of all these three makes us win the disease, and more refinements in technology, in techniques, in treatments have improved the cure rates to a level which we never thought was possible 50 years back. And that's why cancer does not mean cancel. In fact, we can cancel cancer by all these appropriate usage of these different doctors coming together for one particular patient with the goal of eradicating the disease permanently.
Right, sir. So it is the collaboration between medical oncologists, surgeons, and of course the radiation oncologists, which is required and
Yeah,
to
so
win over
here
the
again, I would like to just give an African proverb which tells us that if you want to go fast, you go alone. If you want to go far, go together. That's, as you
right.
said, that's the strength of collaboration. Yeah.
Right. So it is a teamwork, sir. Exactly. So from moving on from treatment to diagnostic part, I feel that AI and technology, like they are playing major role in diagnostics, and there are some home-based and non-invasive screening methods also coming up. So where do you place them, and what is the future according to you?
So, as treating oncologists for cancer patients, we all of us, as the oncology colleagues, need to be abreast of all the developments, the recent advances in medical oncology, surgical oncology, and radiation oncology. Only then we can do justice in improving the cure rates and also increasing all the increasing all the control rates of these diseases. So, cure with passion and care with compassion is what an oncologist needs the most. When you can cure the patient, please cure. So cure the cancer. And also at the same on the same hand, we also should have care for that ailing patient and the family with compassion. So it's passion and compassion, it's cure and care. And therein, these newer technologies with the incorporation of AI make sure that the treatment plan is in place and nothing is no treatment should be futile, it should be having some advantage with the refinements what AI can do in the collaboration and cooperation of all the three faculties and how the treatment is delivered precisely. And this is an area now called as precision oncology. So you
Right.
want to oncology is the branch of medicine dealing with cancer. So precision oncology means precisely targeting the cancer but causing minimal damage to the person who is having the disease. The main worry with some of the treatments is the side effects or the adverse events or the toxic reactions these treatments cause. But now, with the use of AI incorporation happening, you can look at precision oncology more and more coming up in the near future. Precisely identify the diseased area, the target or the driver driving the cancer to multiply, and give treatments, surgeries, chemotherapies, target therapies, radiation therapies to the precise location of the tumor disease. And that's what AI has been doing to us for the past many years, and that will be the future. And
Right.
so, a medical oncologist's dream will come true when I can offer tailored treatment to the patient in front of me. And that's the power of precision medicine powered by AI.
Right. And correctly said that AI and of course the genetic testing helping us to tailor the treatment according to an individual, and with all these targeted therapy, immunotherapy into being, we are reducing the side effects and improving the patient outcomes. Uh, my question to you is, sir, how accessible these treatments are there in India, and people can get it easily, or what's the scenario?
Yeah, ma'am. So basically, as I told before, the diagnosis of cancer sends a shiver down the spine of even the strongest of human beings. Now, once the diagnosis of cancer happens, and then you digest the diagnosis and then decide to fight the disease. And that happens only because all these new treatments have given us hope. A hope that with these new treatments and technologies, we can fight the disease with minimal side effects. So, maximal efficacy against the cancer, but to the patient, minimal toxicity. That's my goal. Maximal efficacy with minimal toxicity. Now, if that has to happen, then the amalgamations of these new treatments should be approachable to all the public. Initially, when the treatments are launched, then they are pretty costly or expensive, and not everyone afford that. But as time goes by, and with more and more generic versions and companies coming up, the cost comes down. And so majority of these antibodies, these target therapies, and the immuno-oncology molecules are now in the reach of more than 60 to 70% of the patient population afflicted with this disease. In the coming years, with all the new patient assistance programs and all the government support schemes going on, this will only get more and more reachable to an even more larger patient population. And that's why maximal efficacy and minimal toxicity will be feasible and possible for the vast majority of the patients who are right now thronging various cancer centers to get an appropriate treatment. So it's not a thing of the distant future, it's a thing of the close future now.
Exactly, sir. So with policies in place, we can definitely make them accessible, and with generic versions coming up, we can cut down the cost. So my last question to you would be that what advice would you give to women today to take charge of their cancer risk and overall health?
So I think as we are started by telling that cancer is curable if diagnosed early, if detected early. And so, prevention is better than cure. This is known to us since our childhood days. Our teachers in our class 2, 3, 4, 5 used to teach us this. Prevention is better than cure. And so, our health is our duty. It's our responsibility because if we are healthy, then our family also stays healthy. And that applies to every family member, but more so for the women in the family because they are the pivot or the fulcrum around which the whole family is resting and balancing. So, women health should be the top priority of each family and family member. And for that, prevention is better than cure. Regular screenings and checkups are very, very important. And when that happens, when cancer is identified early, then we don't have to worry because we all know now that with the treatments in early cancer, especially early breast cancer, the cure rates are in excess of 95%. When such high cure rates are there, I think it would be a big folly not to adhere to the rules and guidelines telling how screening should be done and keep visiting your doctors regularly. Breast self examination, number two, clinical breast examination, and number three, after the age of 40, 50 years, mammography annually can identify breast problems early on and tackle them in a much more effective manner. Please remember that we put a full stop at the end of a sentence. We write a whole sentence and then we end by putting a full stop. Cancer is a word, not a sentence. Diagnosis of cancer doesn't mean a full stop has been put to life. It's part of the journey. God is trying to test us. We will pass the test with distinction. So that positive attitude makes us sail through comfortably. And that's why cancer is a word, not a sentence. And we don't put a full stop at the end of a word. Life goes on, we keep on winning more and more battles. And that's why all my patients of cancer who take treatment for cancer are not cancer warriors. They are not worrying about it. They are cancer warriors, truly. Thank you
Correct.
so
So
much.
they are not warriors, they are warriors. With this note, I'll thank you for joining us today and giving us such insightful, information. Thank you so much.
Pleasure entirely mine. Thank you so much.